really what you're talking about, medical cannabis being safe, the CDC has never found anybody that's reported an overdose of cannabis. Is that correct?
That's absolutely correct. And as it was being stated in the presentation, in my experience, especially if you're using unadulterated product, then you're not going to have any type of experience like that. Any reports that do come in from my experience and my clients has mainly been street product, or it's been adulterated in some way, or there's underlying reasons that, for instance, they may have diabetes, they got the munchies from using a medical marijuana product, and they started eating a whole bunch of sweets, and their blood sugar or something happened, and it was attributed by the physicians to be the marijuana that did it. It's not necessarily the case, but to your point, Mark, and to the slide's point, there have been no overdoses, and the amount you would need to consume to overdose is near impossible.
Manny, we've covered a lot of topics. We've covered a lot of subjects. Let me do a real quick summary. I know that, as I mentioned in the beginning of the webinar, we will be sending you information about the recording, the slides, sponsor discounts, speaker information. And in the meantime, we're going to go to some pre-selected questions that we'll go to. Now, I do want to point out that we have a number of webinars coming up, and you can see over here, this is the one for sleep. Let's go this way. Is this week. We have pain management coming up. We have neuropathy, and of course, PTS this month. So please feel free to join us for those. So here's some of the pre-submitted questions that people have come up with. First question is, what terpenes and routes should I start with for treatment of insomnia and poor sleep? And Manny, I think we just covered this, which is really covering the terpene, the terpenes, which is linalool, myrcene, and terpinolene. I think that's really the key. I know one of the things I like to recommend is, if you want fast onset, take a look at your topicals, flower, inhalation, and concentrates. Longer term, you might want to take a look at edibles and transdermal patches. But really, Manny, this is really the key to really using medical cannabis effectively for sleep.
You're absolutely correct, Mark. The terpenes are pretty much for anything that you're trying to treat, whether it's sleep, due to whatever reason, insomnia or pain or anxiety. If you're dealing to treat those specific symptoms, pain, anxiety, and so forth, the terpene profile is going to play a huge role. And so what you want to look for, particularly for deep sleep or deep relaxation, myrcene usually is going to be the first primary terpene you see on there, followed by linalool or terpinolene. And as suggested in the previous presentation, terpinolene is typically an uplifting terpene. However, when it's mixed with high THC, it does have a sedative and or relaxing effect. So those are the three primaries that you want to look for when you're searching for products to help you sleep, whether it's going to sleep or staying asleep.
I want to just point out, medical cannabis works to help people sleep. I mean, I've seen that happen in many occasions. Probably the most effect I've seen cannabis have is on pain. Okay, which is, I treat a lot of patients in that area, but probably number two is sleep, because people really need to get some sleep. And in the 10 years I've been working on this, I've seen a number of people be able to really get their life back by doing that. Let's run into the next question. It says, I've tried cannabis for sleep before, but it's not working. Or the other question that comes in, it used to work and now it doesn't. What am I doing wrong? Manny, we've heard this quite a bit, and this revolves around not choosing the right either route of administration, but more importantly, not using the right terpenes. Tell me a little bit about this.
Yes, so this is a very typical situation, and it usually occurs about 2 to 3 weeks, if not longer, after somebody started using something that used to work and now it doesn't. And more often than not, it's because your body has acclimated to it. So now it's no longer looking for those specific supplements. And the best way to mitigate that is to find a similar or like product with slightly different percentages in the terpene profiles, but similar. That way you seesaw between these two products and keep the body guessing. Another commonality is that batch of product that you're using, if it's not ratio-based product, like a 12-to-1 or a 4-to-1, and it's a chemovar or a strain-based product, then that batch may be different, off by just a few percentiles, specifically on the terpenes. Within a percent could change the effect of that. So that's why it's always good to document, log, and journal what you're doing and the effects that you're getting from that product. And so that way you can compare your notes with what's in the store, and you can change it knowing that, okay, you don't have this product anymore, or that batch has changed. Let's look at some certificates of analysis, please, and see what terpenes are available on other products that are similar, and you should find success in that.
Yeah, and I think you find that from batch to batch, even though it's the same product, because it is a botanical product, it's a grown product, you can have variations in the amount of terpenes that are in the product.
That's 100% correct. It's grown naturally. They try to get it as consistent as possible. especially if you have a ratio-based product, because those are formulated using the natural product. So like a 12-to-1, as I was mentioning, or a 4-to-1, those are going to remain consistent. However, again, your body still could get acclimated to it and may not be as effective anymore. So that's where you would go from that ratio-based product to a strain-based product. And then once you plateau there, go back to the ratio-based product.
Great. Good. Good. Hopefully that answers that particular question. Leah, let's run on to the next question that's here. Is it safe to combine routes to more specifically target areas and conditions? And I will tell you, I'm going to answer this yes, although I'm going to let Nini jump into more of an explanation. And I want to say yes, because I'm an example of someone who uses a vape pen when I wake up in the morning, because I get instantaneous relief. If you look at the vapes, they work very, very quickly. And so then what ends up happening is that, they work almost immediately, and they work for 2 to 6 hours. But while that starts to work, literally within 5 minutes, my pain level goes from potentially up as high as a 7 down to a 1. I also then take a tincture drops, because that take 20 minutes to work. In my case, about 25 minutes. It'll work for the whole morning, 4 to 6 hours. And then it carries me into the afternoon where I'll use something else. And depending on my day, that could be an edible, another tincture, or something like that. But Manny, this is really, really important, because the route of administration really has to match to the timing that you want. Because if you're doing things during the day, like working, or in the evening when you want to sleep, you may want to change, the route of administration to really help you effectively use cannabis.
And that's, again, correct, Mark. A resounding yes to yes, you can use combining routes. And to your point, Mark, when you're trying to go to sleep, most people, I would recommend to use an inhalant, vape or smoke flower to help you go to sleep. But before you go to sleep, take an edible or sublingual, because by the time that inhalant starts wearing off, that edible or sublingual should start kicking in roughly about the same time to keep you asleep, and rather than waking up and having to inhale again. Also, changing up the products, especially during the day. If you can mitigate your day so you can get more natural sleep at night, even better. So what I personally do is I wake up, I use a vape like you do, Mark, to help me with my pain in my knees and my back. But by the time I start heading out, I take a 1-to-1 product or a high CBD product. So that way I can effectively stay well throughout the day without having to step out and vape or smoke or use a product. And by the time I come home, I change it back to a vape or a topical or both, and a high THC to help me get the rest I'm looking for. And the important part of using that CBD throughout the day is that you're also resetting your receptors in your body by using CBD, as it naturally mitigates the effect of THC. So that way your body's always in a nice homeostasis balance with everything that's going on, and not getting acclimated to just one product that you might be using, and then it's no longer effective and you change to another product.
Sure. I think that's very, very important. And I should point out, again, I'm a victim of someone who has 7 herniated discs in my neck. So my pain, things like arthritis, things like neck, in my case, herniated discs in my neck, they're not going to go away. So I have to work on a program that covers really 24 hours a day, potentially as long as 7 days a week, although I do take holidays now and then to really help reset my body. The other thing I think it's important to point out in this slide is down here, these terpenes, I use myrcene as an example, it really are very heat sensitive. So if you're using something like inhalation, which is vape or flower, you really want to keep that below 396 as far as the temperature, or the setting. If you have a vape pen, it's low, medium, high, keep it at that medium setting. Then you'll get the maximum benefit from the myrcene. If you turn it up to high, what ends up happening is you'll burn off the myrcene and not get the effect that you want from that particular product. You've seen that happen, Manny.
More often than not, especially when it comes to the batteries, a lot of people like to put them on high, or they draw too long on medium or high. I always say, if you want to use it first thing in the morning, like me, I have it on low. As I go throughout the day, it goes up to medium, and then maybe, just maybe, it'll go up to high. But typically, I'm right around the medium point. That's the most beneficial for the terpenes, cannabinoids, and flavonoids.
Right. And this applies mainly to the vaping and the flower, tinctures, edibles, that type of thing. You don't have to worry about the temperature of that at all. So
no.
Hopefully this answers that particular question. Let's jump to the next question that's here. Dr. Holt, who, by the way, couldn't join us tonight. He had a family issue come up, and I apologize for that. But he has been available for us in the past. And Dr. Holt has said that cannabis won't help sleep apnea. Will it make sleep apnea worse? And the answer is no. I've talked to Dr. Holt about this. Sleep apnea is an issue that it's a complicated issue. There's a number of things going on in the brain. And so when it says, will it make it worse? The answer is no. It may actually help to decrease sleep apnea a bit, but it's not going to get rid of sleep apnea. Sleep apnea has to be addressed basically through, let's just say, more doctor hands-on issues, like, for example, having a sleepover where they actually monitor your brain and doing things like that. So the answer is it won't make it worse, but it's not going to make it better. Please consult a professional when you have sleep apnea. The other question is, does cannabis affect your dreams? And the answer is yes. It puts you into a deeper sleep. And I know I use the case of my wife. She tells me she actually dreams a lot more when she uses cannabis. Your thoughts, Manny?
I completely agree. I'm not a sleep physician or a sleep professional in that sense, but I do believe it to be because you're actually getting more into that deep REM sleep.
Right.
So you're actually able to dream and have that effect. Now, whether they're lucid dreams, I think that more depends on what your day was like or if you've had traumas and stuff like that. But I do believe it affects dreams, not necessarily makes them worse or better. I think you just dream more.
Right. I know that when we use cannabis, it in many cases, especially the indicas and the hybrids, will relax our body. And when it does that, what happens is we drop into a place where we get what I call deeper sleep, which is important to us at all. But also it causes us to become a little more creative. That's why a lot of musicians use cannabis. That's why a lot of artists. I know I worked in Silicon Valley for 38 years, and computer programmers were notorious for using cannabis, and our better programmers were all using cannabis. It helped them do a better job, point blank. Next question is THC necessary to activate CBD, CBG to sleep? Related question, what is CBN and how is it different from CBD and THC? Well, let's answer the first question first. Is THC necessary to activate CBD and CBG? The answer is no. They will activate themselves, they'll work on their own. But by having a little bit of THC mixed with CBD, it acts as a booster. It's kind of like 1 and 1 is 3. And that works for both CBG and CBD. It actually helps be able to, and this is where the entourage effect comes into place. It helps you be able to get a little bit more out of the particular product by having just a touch of CBD that's there. Your thoughts, Manny, on that?
I would completely agree. It's kind of like I was saying before, using CBD throughout the day or a higher CBD product will help kind of clean the palate, clean the slate or wipe the slate clean for THC to react better with receptors. It's not necessary to activate, but they do work better together. And CBG is actually the, if you will, stem cell of the cannabinoids. Usually it's CBG, when you apply heat or certain different temperature ranges, it converts to what could be CBD or THC and other cannabinoids.
Right. It's like, it's called, CBG is really the mother of all cannabinoids. It's where they all come from. Now let's talk about CBN, because CBN is a separate cannabinoid from CBD and THC, but it is very effective at really relaxing the body, addressing the receptors that help you relax and help with the receptors that help you sleep. Your thoughts on that, Manny?
Absolutely. So CBN is almost like a degradation of, well, it's not a degradation, but THC degraded actually converts into CBN. So when you're seeing your product turn dark brown or your flower gets brownish, reddish brownish color, that's it converting into CBN, and then it actually really degrades and other molds and stuff can possibly intrude. But CBN is really good for relaxing. It's less euphoric than THC, and it's also harder to find because it takes a little bit more to produce it rather than just letting product age. Right.
And there are dispensaries that sell CBN or CB products that have CBN in it. And it's worth taking a look at using that. It is very effective for sleep. And I've used it with a number of patients that have helped them quite a bit. Let's run to the next question. It says, sometimes my mind races when I take medical marijuana edibles. Am I taking the wrong type of edible? Well, I don't know if you're taking the wrong type of edible, but I know a lot of edibles are high in THC. When you are taking high THC products, your mind can race. Your thoughts on that, Manny?
I'd agree. It also would pertain to, excuse me, the type. So like if you're using a gummy and you actually let it liquefy in your mouth a little bit, where some of those terpenes are getting absorbed more rather than just swallowing it, that can have an effect on that. It could be that, and usually that means that you're using a sativa category product, high in limonene, alpha pinene. And if it's a sublingual, you're just getting more absorption, bioavailability sublingually. If you're taking chocolates or something like that, it could depend on your diet. So if you are taking it on an empty stomach, it's typically actually less effective, or it takes longer to be effective than if you have, like, say, a small meal or small snack right before, if you take it right before a big meal. That plays a huge role. And then, of course, your environment. If you're not comfortable in your environment, or you were stressed prior to taking that edible, that can create that racing mind. I know when I take a product, especially edibles, and I was stressed that day, sometimes it can exacerbate that and boost it up. I think about it more.
Sure.
However, it's very slight. And as your body gets acclimated and used to that effect, it won't happen as frequently, if at all.
Right. And I should point out, some edibles are THC only. They don't have any terpenes in them. They may not have they may not have CBD or CBN in them. I know there are edibles that have CBN in them. So really check the COA, Certificate of Analysis. See if there are CBNs, melatonins, the myrcines, the linalols, the terpenoids, those types of things in that particular edible that's there. And if it's THC only, that's where you are going to get a bit of that racing mind, because it's really going to, it's really not taking all of the components of cannabis that can be used for sleep. It's only taking one of them that it's applying to that particular issue. Let's jump into the next question. It is, how would I know if I overdose on edibles? Now, I'm going to make one real quick comment. One thing you're going to definitely know, you're not going to die. Okay. One of the things about all medications that we run into when we go to the doctor and the pharmacy, and you read the label, it bottom line says it can kill you. Well, cannabis isn't. Okay. What happens when you use too much cannabis? You get high. So meaning you start, you feel this heady sensation that's out there. You could get drowsy. You could get sleepy. You could lose a little bit of your body functions if you take too much of it. So in other words, it puts you into a state that you're not necessarily comfortable, not necessarily your natural state, and may make you a little bit, let's just say, a little bit out of sorts. Your thoughts, Manny?
Yes, I'd agree with that. You can't die from overdosing on marijuana, even edibles. I always recommend people always have a very high dose CBD available. So if you ever have that feeling, CBD can bring you down from that experience within 20 to 30 minutes, if not sooner. It won't bring all the way down to zero, but it should help take that discomfort away. And also when you're using your edibles, always take them in the increments that you get them at the dispensary. So they're usually partitioned, like chocolate bars will have little partitions in them, or they're already dosed, like the gummies. One gummy could be 5 or 10 milligrams. You don't necessarily want to split them, because you don't know what side the medicine is going to be on. They're not homogenized all the time. There's only a few products out there that are homogenized, meaning you could cut it in half and then you have an equal part of medicine on each half. So always take the partitions as they are and take it that way, and always give it about 2 to 3 hours. Start low, go slow, find your nice sweet spot, as we call it, and then you can micromanage or microdose from there on up.
Right. Right. And I'd say the best answer to how do I know if I'm overdosed, you're not yourself. You know what yourself is, and you're just normally not yourself. You're getting a little heady, may have trouble walking, doing things like that. But again, in moderation with the right dosing, you'll be able to control it, and you're in control, and that's what's really the key.
Also, Mark, if I may add to that, I've also seen people where they've gotten to the point where they got sick, vomiting, upset stomach, dizzy spells. My daughter, who uses it for anxiety, accidentally took too much one time and she wasn't feeling too hot. And then panic set in, and I just talked her down off of it, basically. Let her know it's safe, you're going to be okay. That reassurance of having that coach, or even a father in this case, made all the difference for her.
Right. And I recommend, especially if you're new and you're doing a little bit of this, have somebody with you, especially somebody who knows cannabis. They can really help you walk through the whole experience of medical cannabis. Next question is, I've been smoking for years. Recently, sativa put me to sleep much better than indicas. Why is that? And I think, Manny, a lot of this has to do with every person's body reacts differently. And sativas seem to be the trick for this particular person. Your thoughts?
Yeah, absolutely. So any product that you use, actually, when it starts wearing off, it will make you kind of sleepy. That's kind of the body saying, okay, my medicine is wearing off. However, if you're smoking the sativa category, number one thing I always suggest is check the COAs, make sure it's actually a sativa. Sometimes people will go in and purchase a sativa, or it says sativa on there, but the terpenes are singing a different song. And if that is the case, that's perfectly normal. There's nothing wrong. Just your body reacts differently. I would ask if you used the indica recently and if it has the same effect, or do you get an uplift effect from indica rather than sleepiness, or is it just sativas make you sleepy as well? So there's a lot of questions. Get a consultation, reach out to us. I'd be happy to dive deeper on that with you.
All right. Now, you mentioned consultation. This is the second, third time. Let's explain to people what that is. When you go to a medical cannabis dispensary, especially here in Florida, you have the option to be able to ask for a consultation, meaning that what they'll do is they'll sit down with you, they'll go over your condition, they'll go over your recommendations, and they'll actually go over how to use cannabis and the products that they have that'll address your particular condition. And that's something that almost every dispensary here in Florida does. Is that correct, Manny?
It's actually mandated by the state. Every dispensary has to have a consultation room, whether it's used or not, depends on the privacy you're seeking when you're looking for that consultation. It is 100% free, and you don't need to make an appointment for that. However, I would give warning that they are not medical professionals. They're not going to understand the medical jargon or your diagnoses. So what I recommend is to go in there and suggest what effects you're looking for as specific as you can. Therefore, they can use their subject matter expertise on guiding on which products to get.
Now, the next question that comes in is an interesting one. It says, what is the best product to manage anxiety and stress? In reality, anxiety and stress is something that is separate from sleep, but in many ways it's linked to sleep because anxiety and stress will prevent you from sleeping. And in many cases, a lot of it's again, what are the terpenes that work in that particular area? And ironically enough, or coincidentally enough, things like myrcene, things like linalool, and things like terpenoline really help with that. Also, products like beta-caryophyllene are very, very good for that. Your thoughts, Manny?
Oh, of course. I love when you talk terpenes that way. Terpenes are always going to dictate what the effect's going to be. However, I would also recommend when you're dealing with anxiety and stress, try the CBD course first, either a one-to-one, so 50% CBD, 50% THC, and then higher CBD products. The reason I say that is because when you go right into high THC products for anxiety and stress, you can trigger more anxiety and stress if you're not prepared or if you're not in a comfortable setting, whereas CBD is not going to have that effect. Most one-to-one ratio products, 50-50, if you will, is going to have the effect of maybe a glass or two of wine, or if you're an alcohol or a liquor drinker, maybe a shot, maybe two. It's not going to have that super euphoric effect. However, you will be able to digress and relieve that anxiety and stress. And then work your way up to higher THC products now that you have a CBD product with you to help mitigate any uncomfortable effect from consuming too much THC.
Yeah, and we should point out when we talk about using higher amounts of CBD, what we're really talking about is when you hear a product like a 1-to-1 or basically a 4-to-1, that means first number is the amount of CBD that's in the product. So that means 4 parts CBD, 1 part THC. So if you're using a 4-to-1 or an 8-to-1, some people use, for example, my wife will use a 20-to-1 or a 12-to-1 for her anxiety and stress. And it helps her quite a bit. By increasing that CBD level, it can really help your body be able to address a number of issues that are out there. THC is great for handling pain and also for triggering a lot of the positive effects of CBD that's really out there. So I'd say the best products are really go low and go slow and start with the 1-to-1s.
There's one caveat to that, and that's I know a lot of people get turned away from CBD because they don't get that rapid experience that or relief that they're looking for. CBD can take a couple of weeks, if not longer, to really build up in the system. However, you should see some effects upon the first use.
Sure, that really helped. Let's jump to the next question that's out there. What can I take to help with severe sleep deprivation with overstimulating appetite? That is a very good question. I think what we really want to do is you're really going to take a look at something like an edible that can really help you put you to sleep for a longer period of time. And I think the question then becomes, this may take a little bit of, like when we dose, we try different ratios. We may want to try something like that or different products. Your thoughts on this, Manny? Because I think if they were going to use an edible, I would say, especially for sleep in the evenings, they may want to try a chocolate, brownie, or different types of products, really to see what really works for them. Because again, every person's body is different. It will work. We just got to figure out what the right formula is.
Yeah, I'd agree. One of the tricks I use is always use your product, whether it's vaping, edible, sublingual, topical, doesn't matter. Have a meal right before or right after. Like
Mhm.
try to time it when you would normally eat, therefore you don't get the munchies. And if you do,
Mhm.
I always used to, well, not anymore, but I used to carry a water bottle with me anywhere I went. So as
Sure.
soon as I started feeling those hunger pains, I would sip a little bit of water. You feel it go away, and I actually became healthier because I was drinking more water than I was prior. And again, your body will actually acclimate, you'll balance out, and once you find that even keel, you won't experience that as much because you'll be regimented and know how to actually handle
Sure. But again, severe sleep deprivation is serious. And I think that really trying a number of different products to really help you get there. I know that I make I refer to them as my happy brownies, and I have a good friend of mine that had a sleep problem. Tried a few chocolates, tried a few different edibles. I gave him a couple happy brownies, and he called me back and said, "I want a batch." I got to sleep for the first time. So again, it just goes through what works for them, what works for every body is different, and so we really got to figure out from a dosing standpoint what's the most effective for you. Let's jump to the next question, which is what kind of edible or vape can I use to lessen pain and anxiety, enable comfortable sleep, and increase daytime energy? Well, we've really run through a couple of different things. The question is in the morning, afternoon, and evening, what should I use? Because you're talking about daytime energy, you're really talking about being able to use something like an edible during the day that can really energize you, but you also want to pay attention to something that has the myrcene, that has the the terpenes in it to be able to help you get some sleep. Your thoughts on that, Manny?
I would agree with that too, Mark. It all depends on what you're trying to do. Do you work? Are you doing physical work or do you get to work from home? All these things are going to play a role in the percentages of what you're going to use, not just THC, but the terpene levels and otherwise. And for me personally, what I like to use is something called a 1 to 4. So 1 part CBD, 4 parts THC that's high in limonene, which is great for anxiety, as long as it doesn't have a lot of pinene with it, because that can actually induce anxiety. It enables me to relax throughout the day, therefore I'm more eased at night to relax and go to sleep, but it also kind of boosts my energy during the day.
Yeah.
There's other products out there that have both limonene and pinene, as I just mentioned previously. And if your anxiety is not too severe, that's a great energy boost during the day without a super euphoric effect. And sativas in general, the sativa category of uplifting product suggests or is meaning that it's more affecting the head, more uplifting, more clarification. You don't really feel it in the body. So therefore, you're not going to be kind of locked in the couch or rock stone down if you're using too much.
That's a good question. Let's jump on to the next question, which I think is a great question. Is marijuana addictive? This is a great question. And by the way, I'm going to do a webinar at the end of this quarter. It's going to be at I think the first week of June on cannabis use disorder, which addresses this particular issue. So please tune in for that. But let me give you a quick cliff notes on this one. No, it's not addictive. You can stop using cannabis at any point in time. Now, you hit a key word here. As my old football coach used to say, terminology. What does that really mean? What does the word addictive mean? Addictive means something that's very hard for you to give up, something you don't want to give up, or something that you're attracted to. Let me give you an example of myself. I have 7 herniated discs in my neck. If you want to talk about instant pain, try 7 herniated discs in your neck. I can wake up with a level of pain easily with a 7 or an 8, and without medical cannabis, it gets worse than that. When I first had this particular condition, I lived in an awful lot of pain, and I found medical cannabis as my relief. And really, by relief, meaning it takes my pain level down to like a 1 or below, and that's really important. Now, I stop using cannabis every 4 to 6 weeks for anywhere between one. I'd like to do 4 days, but about 1 or 2 days because my body won't let me do 4 days. My neck is just too bad. It's going to tap myself on the shoulder and say, you have to do something. I am not addicted to cannabis. What I'm addicted to is getting rid of my pain. I have not found anything, not pills, not exercise, anything that will get rid of or move my pain down to a level of 1 other than cannabis. So I use it for that particular reason. I don't have any withdrawals. My body isn't suffering any negative effects. In fact, it's suffering a lot of positive effects. But I can stop at any point in time. If I decided to stop tomorrow, I could do that. Now, I'm not sure I would do that because I'd be in pain in 3 to 4 days and searching for an answer, which really the only answer I've been able to find effectively on the market is cannabis. And if anybody knows another one, please let me know because I've tried almost everything. But addiction comes from the fact that you need or want to be able to do this. I want to be able to get rid of my pain. Do I have to have cannabis to do it? No. I'd use anything that's practical. Why do I use cannabis? Because it's safe. Best way of putting it. Your thoughts on addiction, Manny?
The only thing I would point out on that is that cannabis, marijuana actually helps people get off of addictions. And it does it without getting re-addicted to marijuana. I know there's a couple of pharmaceuticals out there that are meant to help with opioid addictions and so forth. But then you get addicted to that one product that's getting
Yeah.
these other ones. So marijuana is great for getting off of addictions, and you won't get addicted to it yourself.
Sure. But really, addiction is something that is it physically addicting? The answer is no. Is it mentally addicting? The answer is no. Is it condition addicting? I mean, condition meaning I want to be able to address my condition. The answer is yes. It can be in that particular area, but it's not a negative addiction. In other words, it's not one that's going to kill you, not one that's going to harm you, and that type of thing. And again, as you can see, what's going on the chart. In June 4th, we're doing a whole webinar on cannabis use disorder. Please join me for that. That's something that a lot of people talk about, a lot of people refer to, and I can tell you, I think a lot of people will be shocked by what it is, what we found, because I've going to reference 5 different studies in doing that particular webinar. So please join me for that. Next question is, what can I use for sleep and pain as I prepare for upcoming hip replacement surgery? Now, I didn't have hip replacement surgery. I had knee replacements. I've had 3 of them, on my right side twice and on my left side once. On my right side, because I basically had my first knee replacement when I was 45 years old, and basically it wore out. Best way of putting it. And I used cannabis this last time, meaning the 7 years or 8 years ago when I was actually having my left knee replaced for surgery, getting ready. And the answer is yes. Cannabis helped me relax. Cannabis helped me get some sleep. And in fact, I worked with my medical cannabis doctor so that when I left the hospital, I had a whole regime to not only address the pain, but also to help me sleep. And it made a big difference. So the answer is yes, you can. But again, it goes back to using products that help you not only sleep, but also address your anxiety and your pain. Your thoughts on that, Manny?
I agree. And I would also recommend be sure to speak with your surgery team or where you're going to be in recovery. Most hospitals that I know of won't allow you to use medical marijuana even in the hospital. So you would probably be relying upon whatever they're supplying you, and then you can use product after the fact.
Good point.
Also be cautious about using CBD up to about 24, 48 hours before surgery, because CBD is a diuretic. It does help dilate the blood vessels. And if you're on a blood thinner as well, they'll warn you about that as well if you're a marijuana card holder. So just be cautious of that. But topicals I find to be very useful, especially around the site that can work. There's lotions and salves that really help with the inflammation, the healing process, and pain. So I would definitely look into that. And then anything else you're already using should help. If you need more specific direction, reach out. We'll be happy to have a conversation.
Yeah. And I should point out, I know a lot of people are nervous about talking to their doctor about it. When I had my left knee operation, which was the last one that I had, I actually told my doctor I wanted to use medical cannabis. And as you pointed out, while I was in the hospital, I had to use pharma drugs. I was operated on Monday. I got a pretty good dose of Percocets. Tuesday, I was in the hospital. I used some Percocets. I was released on Wednesday. But on Wednesday, I didn't take anything from the pharma standpoint. I was released about noon. I was in extreme pain, to be candid with you. I went into my wife took me, she was picking me up. We went into the parking garage. I took a couple of hits off my vape pen. I took some tincture drops. And literally by the time we got out of the parking garage to the street, my pain level had gone from literally about a 9 down to about a 1. Okay, to give you an idea how effective medical cannabis worked on that particular case. Now, I was not in the hospital. I was in the parking garage. And interestingly enough, my doctor was very pro me using medical cannabis. They were searching, the group I was working with was searching for an alternative to opioids. And what they did was they had me work with, I was in a group of 5 of us, 4 people used opioids. I used medical cannabis. They monitored us literally for 3 months. I should say one of the person dropped out after about 4 weeks. After about 2 weeks, one of the people taking the pharma drugs came over and started using medical cannabis, and it really helped me quite a bit. And I should tell you, medical group I work with will actually let you go either way now. Just tell them. They're very much open to that, and they're very much, it's there. It works very effectively. It works as well as any opioid that's out there for pain relief. That's, again, assuming that you know you've done your dosing and you got the right terpene profile and the right products that are there. I think that's really important. Any last comments, Manny, on that? Just use it.
I was glad that you mentioned about the doctor who was all for it, and I find that a lot. It's just a matter of liability. Since it's a Schedule I narcotic with no medicinal use in the United States, doctors are held liable if they were to do that. So try not to demonize them too much. It's not their fault. It's just the law.
Right. Listen, in defense of doctors, they were never trained on medical cannabis. They were never trained on the endocannabinoid system. This is not something they got in school. They have a license. They have a process that they have to follow. It's called the standard of care that they have to go through. And if they don't do that, they can lose their license. So they're very reluctant to recommend something they don't know about or something that doesn't fit their standard of care. But doctors also took a Hippocratic oath to be able to help a lot of people. And that's where I'm finding 10 years ago when I started getting into medical cannabis, I got a lot of resistance from doctors. I would say right now, only about a third of the doctors I've run into are resistant to cannabis. I'd say 2/3 of them are very open to it. They may not know about it. And I do know a lot of doctors refer patients to me and to you, Manny, because they're looking for a medical cannabis expert. In fact, they're looking for somebody who can help really deep dive into helping them with their conditions because the doctors just aren't trained on it. So, give them a break, consult the professionals, they consult the professionals, and let's really get you to be able to help you get your life back. Let's go down as what is the price of an office visit and a card. Here in Florida, you are required to visit a doctor who certifies that you, in fact, have the condition that matches the state of Florida list of conditions. Now, I believe there's 12 or 13 conditions, Manny. I stopped counting them because in reality, the doctor can also take a look at you, and if you have a condition that's similar to one that's on the list in Florida, they can give you a medical marijuana card. An example of that is I have herniated discs in my neck. There is no condition stated by the state of Florida, but because it's very similar to MS, they can give me a medical marijuana card and it's legally binding. And the doctors can then address over 400 different conditions. It may charge anywhere between, for a visit, may charge anywhere between $150 all the way up to potentially even $250. They could charge as low as $99. That's why I use medical marijuana treatment clinics of Florida. They have a support network. They have 22 offices here in the state of Florida. They have a dosing center that you can call. They send you emails and you can actually pick up the phone and call them, get help, and really be able to move forward. And that's really the key. They're not left out on an island, which a lot of people are. And I think, again, when you're looking for the cheapest possible card, a doctor will put you in the registry, he or her put you in the registry. The question then becomes, what do you do? And that's where the card costs vary. You've seen some of that, Manny, haven't you?
I've seen it quite a bit. I actually opened up a medical marijuana clinic for a physician here in Pensacola for a little bit before I started doing my own thing here. And I was pleasantly surprised because for the most part of the market for the last maybe 4 or 5 years, I didn't see that. All it was, okay, here's your medical marijuana card. I recommend you to go. And physicians would put in a blurb into the registry of a recommendation, which at one point I guess was required by the state. They no longer really do that. It was just a blanket, this is how it's supposed to work. And when I opened up the clinic that I did, I guess I was pleasantly surprised because I was able to consult, I was able to pass and give advice, follow up, as you suggested, Mark, dosing, anything from A to Z to help anyone that was interested or came through our clinic doors. Medical marijuana treatment clinics of Florida is another one that really does that really well. I think the clinic I opened followed that lead. And again, like you said, it could go anywhere from $99.99 to up to $250 for the visit. But then you also have the annual license fee that the state charges you,
correct,
$75, and then $2.75 convenience fee, which is paid through the state website. So you could be paying upwards of $325 all said and done, or as low as maybe $185 all said and done. Now the license is every 7 months, or excuse me, every year, and then you do have to visit the physician every 7 months. And correct me if I'm wrong, Mark, usually that first initial visit to get you set up can be up to $200, $250, but then the follow-up visits every 7 months will be cheaper, if not significant.
Yeah, they're usually around $99, maybe $120. The second visit is usually a lot cheaper because all the paperwork's been done and you're in the system itself. State of Florida requires that. It's not something that the doctor's trying to gouge you for more money. They require that you have a doctor look at you every 6 months and fundamentally verify that you still have this medical condition. And I would love to have my herniated discs go away. I mean, I'd love to have that. I'd love to have a doctor say, listen, they're gone. But unfortunately, that's not going to happen. So I think you have to have those 2 visits that are really out there. I would say I would budget somewhere between $350 and $500, depending on the group. And it's going to be probably north of $400 if you're dealing with a professional group that has the support that I think that you need. That is peanuts compared to you being able to get your life back, being able to use the product effectively. And candidly, they'll actually help you guide you to the right products to use, so you're not buying products that aren't the right products, or they really they don't work for you. Your thoughts on that, Manny?
I couldn't say it better than that, Mark.
Great. Okay. Let's move on to the next question. Does marijuana lower blood pressure? Well, lowers and raises blood pressure. When you first take medical cannabis, remember that cannabis is distributed through your body, through your bloodstream. So what will happen is you will find an increase in your blood pressure initially when you take medical cannabis, but cannabis is doing its job. It's working for you. Now, what happens is that as your body begins to absorb the cannabis, as it begins to settle down, as it begins to take effect, then you potentially can see a lowering of blood pressure. Now, I want to caution, cannabis is not a blood pressure medicine. I would not take cannabis if you're trying to address blood pressure. I would use more of a form of drug for that. But cannabis and certain terpenes are known to be able to help you lower your blood pressure if you use them. But again, you have that, it's going to take effect, it's going to start working, and then when it takes effect, it really lowers down. Your thoughts on that, Manny?
I was exactly going to say the same thing. Initially, that stimulating effect of cannabis entering your bloodstream kind of gets that heart racing a little bit and your blood pressure goes up. But as you balance out, as you suggested, Mark, it kind of lowers and it even gets on a nice even keel. I like to call it, along with the biphasic effect, your body's in homeostasis.
Right. I think that's really, really important. So again, let me be very clear. If you have high blood pressure, talk to your doctor. But if you by using medical cannabis, your blood pressure can be lowered. I know I drive my doctor absolutely crazy because by using medical cannabis, especially when I'm in my training routine, my blood pressure actually goes low to a point where he gets a little nervous because I'm actually getting in better shape, which I think is good. Okay, but it's something that you really got to pay attention to. Next question is, I'd like info on idiopathic peripheral neuropathy. Now, I should point out that next week, in 2 weeks, we're doing a webinar on neuropathy on April 23rd, and we'll address neuropathy itself, the products to use, and that type of thing. I'm not a medical expert, so I'm not going to jump in today on idiopathic peripheral neuropathy. What I'm going to do is, I think we have your email address, and what I'll do is I will we'll actually get back to you on what that actual condition is, but we'll address it also in the managing neuropathy webinar that's really out there. I want to make sure I fully understand that type of neuropathy and be able to address it. Now, I do know that from a blanket standpoint, cannabis helps quite a bit with neuropathy. And in fact, I've seen it do some absolutely remarkable things. I have a good friend of mine that's in Las Vegas that suffers from neuropathy, and I've helped him with medical cannabis, and he's really got his life back by being able to use medical cannabis. Your thoughts, Manny, on that?
So far, my best experience has been using one-to-one high CBD products rather than high THC products, and topicals, believe it or not. Topicals and sublinguals like tincture oils work really well. But like you, I'm not a medical professional. I'm not really knowledgeable on this specific type of neuropathy. So I would like the time, like you said, and we could get some information and really put it out on our next webinar in 2 weeks.
I just want to do a double check, but I think you hit the nail on the head. High CBD product helps quite a bit with neuropathy, and because it's not just addressing the CB1 and CB2 receptors, it's addressing a number of other receptors in your body. We'll talk about that on the 23rd, but really, thank you very much for the question, and we really want to dig down on it. I'm not trying to push it off. I'm just trying to professionally manage it for you. This is from the live questions that were out there. One of the really good questions is, why is myrcene listed as the first of each strain you show? You know, the fascinating part is, someone once told me when I first got into cannabis that myrcene is in every strain. Is that safe? I mean, you've worked for a dispensary. I've seen myrcene in almost every product. What's your thoughts, Manny? I know myrcene is one of those products that shows up in every product, and it depends on how much. Your thoughts?
Yes, myrcene is the most common one in just about every cannabis product. If you actually look at a full certificate of analysis, that terpene list could be 50 terpenes long, and it'll be somewhere in there along the lines. But to answer that question, why is myrcene listed first for each hemivore or strain that we listed, is because myrcene is the primary one that dictates that that product is going to be in the indica category and meant for relaxation, sleep, in the couch lock effect. This kind of really affects the body. And it works really, really well for sleep. And so that's why those specific hemivores or strains listed myrcene first. And then linalool, I call it its little cousin. Sometimes you'll find myrcene and then linalool later down the list, or linalool might be first with myrcene a little down the list. But if myrcene's first, usually it's going to be more of a couch lock sedative effect. If linalool's first, it's usually a relaxation effect.
It is a very common terpene found in a lot of products. But why do we list it? Because it works.
To give some contrast on that, Mark, if we were going to discuss something like that, we were going to use more for the daytime, for anxiety or stress daytime use. Probably all the hemivores or cultivars that we listed would probably have limonene and or pinene listed first, rather than.
Yes.
So to just give you some contrast on that.
Yeah, that's a good point. It's there. Now we're talking about overall sleep. We're not talking about during the day and keeping you active. So let's also keep that into consideration. Sarah asked a question: is CBN for sleep? Well, CBN very effectively addresses sleep. In fact, it's one of the terpenes that addresses the receptors that affect sleep, and it really does help people relax and fall asleep. Your thoughts, Manny?
I'd agree. CBN is the cannabinoid that most do use for sleep, although it's not particularly meant for sleep. But because it's so effective in doing so, that's why people use it. It's really good for relaxation, a slight euphoric effect that more than likely will lead to natural sleep.
Now, CBN works very effectively, and I think that doesn't mean that there isn't other products that work. There's a lot of one-to-ones, high CBN, high CBD ratioed products that work and things like that. But CBN is really good for sleeping. And let's jump to the next question. Susan has a great question about restless legs. What do you recommend? Hard to find info on restless leg syndrome. You know, it's interesting. It is hard to find info on that. There have been a number of studies in both Canada and also in Israel on that. And the answer is yes, it can. Manny, do you want to take this one or you want me to jump into it?
I'll follow up on your lead, if you don't mind.
Okay. So restless leg syndrome is something where you have muscle, basically, I'll call it spasms. Now, they're not as dramatic as some of the spasms you see if you have, or you're epileptic or something like that. But it does cause your legs to be able to, let's just say, have some spasms. It comes from a number of different things. It comes from overexercise. It comes from a lack of exercise, which is the opposite that's there. And it really, it's the muscle memory of your legs recalling itself and coming back. Cannabis can help quite a bit. What cannabis can do is really help to relax those muscles, relax those receptors that are causing that restless leg syndrome, and be able to put you in a mode where you can be able to just relax quite a bit. Now, again, there are a number of, the reason that you're finding hard to find info on it is because there's a number of conditions that list restless leg syndrome. Probably the best studies are done out of Canada right now, out of the university in McGill University, because they're doing a lot of work in this particular area on sleep in general, and restless leg syndrome falls into this category. But what you'll find is that you want products that are relaxing. And what's interesting is that, again, it's tied back to the receptors that are in your body that really are helping to trigger your legs and being able to have them work.
Yeah, absolutely. There's actually two products I would recommend from two different dispensaries, actually. One and products in general, patches work really, really good in this scenario. You put the patch on the top of the foot where it's nice and veiny and thin skin. And it should be systemic, meaning it's going to get into your bloodstream at a very, very low dose, so you may not even feel the effects of it. But I would use a high CBD one-to-one patch like Soothe from Surterra, then a tincture. Again, Soothe one-to-one from Surterra, or I like Move's patches, MUV Move, because they have 72-hour patches. So they last a lot longer. And you could take them off, remove them, put them back on, and so forth. But patches and tinctures I found to be very successful in dealing with restless leg. My wife, who suffers from that from time to time, hates cannabis. It's not that she hates it, she's very sensitive to it, hypersensitive. So she can only use a little bit. But the patches work miracles for her restless leg syndrome. And then she just started diving into the tinctures a little bit, which is why I know those are working as well.
Right. So hope that answers that particular issue. It is effective. I know a lot of the sports teams, our Olympic committees, use a high concentration of CBD, not only to be able to help them get their bodies back into condition because it addresses the proper receptors, but also to try to prevent things like restless leg syndrome and address those receptors. So I hope that helps quite a bit. Anonymous, that's a really good question. Hi, I'm trying to get off of benzos that I've been taking for 20 years for sleep and anxiety. What would you suggest? First of all, I'm sorry that you had to go through this for the last 20 years. It's not a cold turkey thing. I wouldn't stop one day. If you're going to get off the benzos, wean yourself off of those and wean yourself onto medical cannabis. And I think the products that we want to use are the ones that we outlined here in the presentation. Those that have the myrcene in them, ones that have the linalols in them, and ones that have the terpenes, as well as you may want to take a look at some beta-caryophyllene as well. I know that, again, that if you wean off and feed off, by wean off and on, meaning take 2 to 3 weeks to make that transition, not 2 days. Your thoughts, Manny?
I would agree on that. And again, I don't know why I'm really going back on CBD a lot this presentation, but I would highly recommend CBD products 1 to 4. Or 4 to 1 or a 1 to 1 that will be great both for day and nighttime. And I think that will really have a significant impact, especially since it's going to take about 2 to 3 weeks for it to build up in your system. The same amount of time you should possibly take to wean off of the benzos. It should marry up really nicely to where you could find that sweet spot and get a better quality of life.
The next question is a good one. Which terpenes are best for sleep and which method will work best? Now, again, we talked about the terpenes, so I don't want to beat that horse to death because we've kind of gone over that quite a bit. But again, linalols, myrcenes, terpenolenes, germinal, and boronol. Now, when you talk about what route of administration, I have a golden rule. Which one will you use? You can recommend, for example, you can tell someone or recommend for someone to use flower, but if they don't like the smoke, they're not going to do that. Or if somebody likes to use vaping and smoking, they don't really want to use topicals, or they don't want to necessarily use tinctures. I would say for fast onset, again, the chart here shows topicals, flowers, inhalation, and concentrates work best. For longer durations, this is where edibles and transdermal patches come into play. That's in there. But really, I wouldn't shy away from a high CBD ratio tincture as well. Your thoughts, Manny?
100%. I always recommend if you have trouble falling asleep, use a vape or an inhalant that should help you fall asleep. If you're having trouble staying asleep, you want an edible or transdermal patch or something ingestible. If you're having trouble with both, you take your inhalant and then your edible before you fall asleep. But to your point, Mark, if you don't want to inhale, then you just want to take your edible a little bit earlier or in enough time when you know it should start kicking in. Because you don't want to take it, let's say at 5 o'clock, you don't go to bed till 9, 10 o'clock. It's going to kick in a lot sooner than that, or at least it should. And now you're going to sleep a lot earlier than you wanted to. You're not achieving the things you wanted to achieve. And then you're waking up earlier than you expected to wake up. So the timing on this plays a huge role for what works best and for what method you're trying to treat, or excuse me, what symptoms you're trying to treat.
Yeah, I mean, look, for me, and I'll talk about my particular area. I talk about my magic brownies. What are my magic brownies? Ghirardelli chocolates have met cannabis. In many cases, I use flour, or I've used an RSO a syringe to make my happy brownies, mixing them very well. And I find that a half a brownie is just fine. Helps me fall asleep and really gets me to where I really want to be. I'll be able to sleep through the night, and that's really important. If I don't do that, I tend to wake up at 1 or 2 in the morning, have trouble falling asleep, and that's something I really don't want to do. So, Manny, your thoughts on which route of administration makes sense as far as, I think it has to do with coverage. Is that correct?
Yes, absolutely. And then again, if you're not having trouble staying asleep, you don't necessarily need an edible to go to sleep. And that only if you're not trying to inhale things or vape or so forth. So it all depends on what you're comfortable with. You have so many 5 different routes of administration that you can work with, and then a smokable route. So get that consultation, play around with this, because this is a personal journey that you're not prescribed what to do. You're only given a recommendation to use marijuana. So keep that in mind and get that consultation, take your time to seek it.
Now let's go into the next question, which is how much flour in milligrams should I add to my CBG flour to activate it. First of all, CBG flower activates on its own. I think that's pretty safe to say. But I think this really depends on the person. Your thoughts, Manny? I think every person's different.
I'm a little, how much THC flower in milligrams should I add to my CBG flower to activate it? That kind of is a back and forth question. And you're right. If you spark CBG, it's going to convert into THC or CBD or whatever else. It's the acidic version or CBGA, and then you get THCA, and then when you light fire to it, that carbon molecule burns off, and now you got delta 9 THC, or depending on the temperature, you might have THCV. So there's a little bit of chemistry that goes into this, but there's no activation. It's heat activated. Or if you ingest it, and if it's just CBG, it's not going to convert in your gut. Delta 9 converts in your gut, or hydroxy, 11-hydroxy will convert into your gut, but it's not going to be the same by adding THC flower to CBG flower. It's kind of the same thing. I'm a little confused, and I'm sorry, Dean, that I may be misinterpreting your question on that.
Yeah, I mean, you really don't need THC to trigger it. It does help, okay, but I think I think it really is something that you may want to just try and experiment with. It just depends on what works for you. I don't think there's a formula that I know of anyway. Many, you know of anyone?
No, I think because when I see CBG flower, I'm considering that it's not necessarily from a dispensary, or maybe not from a dispensary in Florida. I haven't heard it categorized that way before, so I'm a little confused.
Next question is one that's probably more up your alley, although I do have an answer that I can help you with. Where do you buy CBN in Pensacola? Very hard to find. Really does it. It went out west. They said it was only about 50% effective. First of all, I don't know who you talk to out west. I'm a medical cannabis professional, and I can tell you that it works. Okay, and more than 50%. But I do also, as a medical cannabis professional, have to say it depends on you. Every person's body is different. And so some people, I mean, I know of people in this industry that have exactly the opposite. CBD has exactly the opposite effect on him that it does to me. It acts like THC, and THC acts like CBD to them. About 2 or 3% of the population have that particular characteristic. So again, you have to know what your dosing level is, what your body is really sensitive to. Now, I can tell you CBN does work. So don't throw it out because people have said it's only 50% effective. It works. Okay. Now, where to buy it in Pensacola? Your thoughts, Manny? I have a couple of suggestions.
I think Sunburn has it and True Leaf has it. I'm not too familiar with the other ones that have CBN. I know it was a big rush for a second, but again, it's kind of not so cost effective for dispensaries to process CBN just yet. That said, and before you mentioned the other places, Mark, one thing that I find if you can't find CBN is CBD high in myrcene. You won't get necessarily the euphoric effects that you would from CBN, but you'll get the same sleep effects, if not more significant. So if you can't find the CBN, I would recommend a high CBD, heavy in myrcene and or limonene. Yeah,
and by the way, I was going to mention that I know that there's a True Leaf product that you can buy. I bought my CBN from True Leaf because they have CBN product, and I haven't tried Sunburn yet, but I know that they carry that particular product as well. There's a couple of sources. There may be others. I haven't had a chance to look, but I'll have to take a look at some other dispensaries. Those are two that I know that are there that are in Pensacola. So I hope that answers that particular question. Tracy Act, does baking the brownies harm or degrade the terpenes? Great question, Tracy. Thank you very much for asking that question. You get a gold star for that one. If you take terpenes and if you take your cannabis flower and you throw it right into the cannabis, your brownies will bake at 350 degrees or more, okay? And it'll burn off most of the terpenes or degrade some of the terpenes. What you want to do before you put the cannabis in the brownies is you want to decarboxylate it. What does decarboxylating mean? I take the flour, I take a tray. What I do is I break it down, I kind of grind it down in kind of ground flour. And then what I do is I put it in the oven for 40 minutes, 40 to 45 minutes at 240 degrees. Now, when I do that, what it does is it basically brings those terpenes out and converts them that are there. Okay. So now you've got a cannabis flower that the terpenes are baked into it. So now when you add it to the brownies, it doesn't degrade the terpenes, or it minimally degrades the terpenes. Your thoughts on that, Manny?
I don't do much baking. I do decarboxylize a lot of flour and make tinctures.
Mhm.
And I take the same steps effectively. I decarb out my flour so that way I can maintain the terpenes and the flavonoids to the best that I can. And typically, whenever you bake anything or if you're cooking with cannabis, you got to be low and slow because the higher the heat, the higher chance you're going to actually take away the effect of what you're trying to achieve.
Sure. And here's the temperature range and the terpenes over here that get triggered. But again, if you trigger them at 240 degrees, decarboxylate beforehand, and then drop that into the brownie mix, you'll find that you do get the terpene profile. And I know it works because I'm looking for certain terpenes to address my particular condition, and I know they're there because it does. Okay, so decarboxylation is key. If you just take the flour and throw it right into the brownie mix, you're going to you will degrade the terpenes and a lot of the cannabinoids that are really there. So I hope that answers that question. Now, the next question, which I think is also a great question, is can I get your brownie recipe? My brownie recipe is extremely complicated. I go to Costco. I buy Ghirardelli chocolate brownie mix. I like the ones that are fudgy with the little chocolate chips in it. I will take that box. I will decarboxylate 7 grams of cannabis. Again, grinding it up, doing the 40 to 45 minutes of cooking it at 240 degrees. And by the way, after it finishes cooking, I let it sit for about a half hour to 45 minutes to be able to do that. Then when I put it in the brownie mix, I actually make sure I mix it very, very well. I know I mix it to death because I don't want to have part of the cannabis be in one part of the brownie and not in the other. Now, if you really want to get down into making your own brownie mix, I recommend talking to Sherry Cannabis. And Sherry will give you a 20% discount if you go out to her particular website. She has a whole cookbook. And I've used her cookbook on a number of occasions on edibles and topicals and how to dose and how to calculate. She walks you through all of that, both in video and also on in her books themselves. So one is what I call the quick and dirty, which is grab yourself some Ghirardelli chocolate mix and mix it that way. I found it works very effective. And then there's also, if you really want to be a cook and you want to dig into more, let's just say, recipes where you're more hands-on, Sherry comes into play, and Sherry does a great job. I think she's one of the few people in this industry that I think really knows how to cook with cannabis effectively. And I'd say take a look at that. Any last comments or any last questions?
Well, actually, I hope we didn't put anybody to sleep during the presentation. Hopefully you got some great information. Mark, always thank you for having me on here. I hope I'm able to share with people some information. You can find me, as it shows on the slide, thebluntjoint.life. It's a free service. Please feel free to reach out, ask any questions, not just about sleep, but about anything about cannabis A to Z, whether it's just yourself, somebody you care about, or a group of people. I'd be happy to help. And Mark, I'll be looking forward to being with you next week.
Yeah. And by the way, I do want to promote your program, The Blunt Joint. I think it's hard to find people in this cannabis space that really know what they're talking about. But people like Manny and your Blunt Joint, ourselves, Marijuana Aware, we're really here to help you. Our Marijuana Aware program, which is not only just this webinar, which you can sign up through Marijuana Aware, and we have more webinars this quarter on pain, neuropathy, PTS, arthritis, cannabinoids, personalized treatment, and also on cannabis use disorder. If you're looking at getting a card, as I mentioned in the presentation, I recommend Medical Marijuana Treatment Clinics of Florida. We hope that we have helped you get some information to candidly help you get a good night's sleep, help you get your life back. And we look forward to hearing from you. And more importantly, we look forward to having you in some of our future webinars to help you with pain, neuropathy, or whatever condition that's really out there.